Okay, so today we are going to deal on most important topic, so that is diabetic mellitus. It is also we call as diabetes in a simple way. So before going to the diabetes mellitus, we should know some of the basic things related to the pancreas, because pancreas is a very important gland in the body. It performs a certain functions. It maintains the normal hemostasis internal environment of a human beings. Here the pancreas also we call as so the both endocrine mixed gland area, so that is heterocrine glands, because it acts as both endocrine as well as exocrine gland. Here the pancreas having the different cells. Okay, so those cells will collectively called as islets of Langerhans. Right. The pancreatic different cells having the different functions, their secrets are different. So the hormones it maintains, so that is normal glucose level in human beings. Here, pancreatic alpha cells it secretes glucagon, it increases the blood glucose level. The pancreatic beta cells it secretes so that is insulin, it decreases the so that is blood glucose level, as well as pancreatic so the delta cells secretes somatostatin. The pancreatic pp cells secretes a pancreatic polypeptidase, and pancreatic epsilon cells secretes a ghrelin. It is also called as a hunger hormone. It maintains the appetite. Okay, so this is regarding to the clear cut small information about the so the pancreas. Now coming to so diabetic mellitus. Here in India, so that is 1 billion people suffering from so that is diabetic mellitus. Here the 25 million people they were pre-diabetic. Okay, so pre-diabetic means they are having a so that is an increased level in blood glucose level, but they are not having any symptoms, but not they are not taking any treatment. Now come to the so according to the 2022 census in India, so that is among 9 people, the one individual is suffering from so that is diabetic, so that is mellitus. Yeah, the study conducted on the diabetic mellitus, so that is assume that in the year, what is incidence of so the diabetic mellitus in the year, so that is 2015, here every 8 individuals, among 8 individuals, one individual suffer from so that is the diabetic mellitus. Now, here among so 10 people, the 4 people having diabetes mellitus, but they are not aware about the diabetic mellitus. Now coming so there is 90% people they are having a diabetic mellitus, that is type 2 diabetic mellitus. From the definition, so according to the so American, so that is diabetic associations that they given, so that is a standard, so that is definitions regarding to the diabetic mellitus. According to the so American Diabetic Association, so the diabetic mellitus is defined as it is a group of chronic metabolic disorder characterized by the hyperglycemia resulting from so that is insufficient insulin production or ineffective insulin use is called as so the diabetic mellitus. Okay, in a simple way, the diabetic mellitus is defined as it is a group of so that is metabolic disease, so characterized by increased so that is sugar level in the blood, so that is hyperglycemia as resulting from so insulin secretion or ineffective use of insulin, so that is we call as so that is diabetic mellitus. Now, what is the meaning? What it means? It means diabetic means so there is an increase the sugar level in a so the blood. Now coming to causes. Here so the different causes are there. The most important cause is insulin only. So that insulin secretion is one cause. Insulin secretion is there. The body cells resist to use the insulin. Okay, so it is the most important cause for a diabetic mellitus. Here insulin so deficiency. Here insulin deficiency is the first factor. But insulin secretion is there. But body cells they are having a resistance against to use the insulin. They are not taking a proper use of the insulin. So it is also the most important so the cause. Next, the some of the factors, so the contributing factors to the okay cause the diabetic mellitus. So that is lifestyle factors. So the alcoholism, the tobacco chewing, and the sedentary lifestyle. They are not having they are not doing any physical activity. Okay, so physical inactivity, obese, and age after that so the age of 35 years the incidence, okay, so that is increases in this will develop so diabetes. According the diet factor is also very important factors contribute for causing a diabetic mellitus. Genetic factor is also the very important factor to contribute, okay, so there is occurrence of a diabetic mellitus. Okay, so here the beta cells are very important. Because the beta cells functioning normally, it secretes cells so that so insulin that is the glucose level becomes normal. If the beta cells, so that is the damaged or so pancreatitis infection is there, means so there is no insulin so productions again, so there is an increases in the so glucose level. Let's look at the types of so there is diabetic mellitus. Okay, according to the diabetic so association, American Diabetic Association, they classified so diabetic into four types: the type 1 diabetic mellitus, type 2 diabetes mellitus, type 1 diabetes mellitus, type 2 diabetes mellitus, secondary diabetes mellitus, and gestational diabetes mellitus. Here the type 1 diabetes mellitus, it occurs in children. It is also we call as an insulin dependent diabetes mellitus. It means there is no insulin so production is there, so there is external insulin is needed, so there is the form of injections. So now come to the type 2 diabetes mellitus. Here the insulin production is there, but body cells resist to use as available insulin. Now come to the secondary diabetes mellitus. Diabetes mellitus resulting from so the secondary is like infections. For example, pancreatic, so there is infection, pancreatitis, and pancreatic tumors, pancreatic cancer. Okay, so this is about the secondary, so that is diabetic mellitus. Now coming to the gestational diabetes mellitus. Here, gestation is nothing but related to the pregnancy. Here, during the pregnancy, what happens? So there is a placental hormone secretions take place for maintaining a, so that is pregnancy. But okay, placental hormones having a, so it develops resistance to use as so the insulin. Okay, so this is also most important contributing factors. So that the woman okay is pregnant, woman will develop a, so that is diabetic mellitus. But after the pregnancy, what happens? There is no placenta, there is no placental hormones, but okay, so the insulin level becomes abnormal. Okay, so this is regarding to the gestational diabetes mellitus or pregnancy induced diabetic mellitus. Now come to the what are the clinical manifestations or the signs and symptoms we are going to see the persons who are suffering from so diabetic mellitus? It is also we call as a 4P disease. Because polyuria, excessive urination, polyphagia, polydyspia, as well as okay polyneuropathy. Okay, so these are the most important clinical manifestations we are going to see the persons who are suffering from so that is diabetic mellitus. And also so blood visions, so the fatigue, so the tiredness, restlessness. Okay, so all are the symptoms of so the diabetic mellitus. Now come to the how we are going to diagnose, how we are going to identify the person who is suffering from so that is diabetic mellitus. So the blood checking, so that is HbA1c, so that is insulin, the random glucose check, RBS, and the PPS postprandial blood glucose checking, and the OGTT, it means oral glucose tolerance test. Okay, so these are the different diagnostic measures are there who are diagnosed the so diabetic mellitus. Now come to the complications resulting from so the diabetic mellitus. Here it causes the multiple so that is complications. Okay, so prevention is better than cure. Here if we are going to so maintaining a so normal glucose level, we definitely will prevent the so the complications resulting from so diabetic mellitus. It may causes so that the cardiac problems, so myocardial infarction, stroke, it also causes. It may causes so that is coma, so that is the diabetic coma, so that is the patient who are suffering from so that is diabetic mellitus, suddenly they go under the, so the diabetic coma. So diabetic ketoacidosis also happens because of severe coma, the delayed wound healing, the wound will not heal properly. Okay, so these are the okay, so blindness will happen, the diabetic neuropathy, diabetic nephropathy, and peripheral neuropathy. Okay, so all these are the important complications resulting from so that is untreated or uncontrolled diabetic mellitus. Okay, so this is regarding to this. Now come to the complications. Now come to the manage. How we are going to manage? The first thing is the exercise is the first step to manage the diabetic mellitus. If you are not okay, so regulating, not maintaining a so the sugar control means you have to go under the oral anti-hypoglycemic drugs. So the metformin and the insulin also. The last one is here. The last the optimal or so the correct management for the so the diabetic is the regular physical exercise and the regular taking so that is drugs is the most important okay, so the key rule to manage so diabetic mellitus. Okay, so this is how we are going to prevent a diabetic mellitus is the regular exercise is very the very so the need for so the control also to prevent diabetic complications. Okay, so this is regarding to what clear cut information regarding to the diabetic mellitus.